In my business, one of the things that I reiterate over and over again is taking care of the person in front of you. And so in this video, I want to talk about the steps that you can take to create a great patient-client relationship. And this is under our professional growth track on the TSPT Academy. And this transcends, hopefully you'll see that a lot of these lessons can apply to all your relationships in life. And if you approach it that way, and if you approach these 9 steps that I'll talk about, it's very easy to see where you might miss a step that could offend somebody or not make someone feel valued. So let's get into it. When we talk about how to create a great relationship, we're really looking at the value of that relationship between people. And so customer or patient value management is an approach to managing all aspects of the value journey. And that value journey from a business standpoint comes from the very first impression where someone hears about you or sees your post on Instagram or gets an email from you, all the way to the end of their plan of care, really, and beyond, because beyond that is how they start telling other people, and that's where the referral network spreads. And I think it's partially how I was raised and grew up, but I think some of this stuff comes very naturally to me because I try to take care of people and I feel like I'm an empathetic person. But when you follow these steps, and I've also seen where I've gone wrong on certain ones and how relationships have not gone the right way. And so when you follow these steps, and this is something that I regularly review, then it makes it easier to take a patient or a client and have a great relationship with them all the way through the plan of care. I think we all have those moments of, oh, I really connected with so-and-so, but I didn't connect with somebody else as well. And that's natural human nature. I mean, we all have tendencies to like certain personality types more than others, but following these 9 attributes, which are accessible, responsive, knowledgeable, prompt, keeping promises, keeping your clientele informed, don't surprise them with anything, doing it right, and having consistent follow-up. That is a way to have consistency among even those clients who you might not get along with so well, but you're still able to have, from a business and relationship standpoint, a great interaction with that person. This content is derived from Ray Kortopusky's book, Mastering Customer Value Management. And he was someone that worked at the AT&T organization and really helped them increase their value to the marketplace. So that's where these 9 steps come from. So the 9 attributes of a great relationship. How I think about this from my business and the physical therapy standpoint is I need to be accessible. And that accessibility comes from that first impression someone has. So am I easy to find online? And then am I easy to schedule there? So on my website, I have a specific widget tab that hooks up to my Google Calendar that allows me to schedule. And I've had a cash practice for the last 7 years now. So someone gets on the website, they read about me, and then they can easily schedule. And so that accessibility is a huge step of not losing clients. Next is being responsive. So oftentimes someone will read my stuff about me on the website, but then have a question or two. So then that step of, once they ask that first question, I'm quickly responding to say, hey, this is how I can help you out. This is the best thing that I can do. And you see that I'm getting back to you quickly, and that responsiveness drives confidence. Next is knowledgeable. That actually goes more back to our clinical mastery track of when someone reads about me online or the first time we have a conversation, I want them to see that I'm a subject expert on orthopedic, physical therapy, pain science, movement. And by answering their questions, they're going to quickly see that I know what I'm talking about and that I can help solve their problem. Next is being prompt. Oftentimes in the medical system, people will wait for 15, 30, up to an hour long to see a doctor. I want to make sure that my people are getting in quickly. So I don't make them wait. Once I hear that they're up in the front area, I get them and we start the session right away, because I want them to know that their session starting, as I want them to be prompt for me, I'm going to be prompt back for them. Continuing on, keeping promises is huge. And that seems like common sense and it's obvious, but if I say we're going to do 3 times a week this week, I want to make sure that I'm getting that person in for 3 times. If I tell them that I'm going to email them their home exercise program later that night, I'm going to email them that program. So I'm delivering on those tasks or the different goals. And that even goes for their plan of care. If I say we're going to get you better in 4 or 5 visits, I'm creating that relationship. I'm building trust with them to get them better sooner. Next, keep informed. That's if I need to change an appointment for whatever reason, if how they're progressing isn't as fast as I think they should, if they're not making progress on certain exercise part of the plan of care, or if they're not following some of the habitual patterns around their pain, I'm letting them know what I'm seeing and keeping them informed builds that trust, honesty, and sort of integrity of the relationship. Next, no surprises. If I don't have this problem at my clinic because it's just I'm the only practitioner, but if they're going to be working with different treatment providers, or if half the sessions with you and then half of it is with a PTA, let them know those things so they don't feel shocked when the eval is with you and then they get sort of passed on afterwards. So, and also no surprises. There should be some flow through the treatment session, your treatment paradigm of reviewing a subjective, seeing where they're at, reviewing exercises, doing manual, doing your updating exercise progression. There should be flow through that. And then lastly, no surprises with the billing. Like, one of the things that I hate the most is when I get a medical bill 3 months after the fact from a provider I saw a long time ago, and I'm wondering where the bill came from. Is it even accurate? That those are all areas where it feels like you've been cheated a little bit, and I try to avoid those as much as possible. Next one is do it right. So with me, that's following the evidence and then taking care of the person in front of me, because oftentimes we can get bogged down on paperwork, or the second and third person's coming in, or you're getting hungry for lunch, but all those things distract you from taking care of that person right in front of you. So by following the best evidence-based plan of care and then executing that on the person in front of you, that's the way to do it right, and that person will come back and come back again. And also, yes, we're in a business, but ultimately that business is to take care of people. So always the client's health and wellness, and if they need a few extra minutes, or if they need extra time to have some questions answered, that's doing it right. Lastly, follow up. So after I see somebody for an initial evaluation, I reach out to them a day later to see how they're doing. I want to make sure that they feel like, okay, we had our initial treatment, you came in, we built this trust. I want to make sure that that trust doesn't leave afterwards, that I'm following up with the person to make sure that they are on board with what they're doing. They didn't have any adverse effects to the treatment session for whatever reason, and that they feel confident with their home program, because I probably won't see them again for a week or 2 or 3 days even. So in that standpoint, I want to make sure that they are good in the direction that they have moving forward. Now, when you follow those 9 steps, those attributes, then that will help you maintain the best relationship all the way from start to finish. And it's, as you see, like, these should follow the normal relationships in your life too. If I practice these things with my wife, I'm sure she's very happy about that. But those attributes is what builds a great relationship, and that transfers patient-client relationship at the office, and it also will with your friends and with your family. But using these things will help build value for you and your business. That's another video from our professional development track on the TSPT Academy. Thanks for following.